Something came out of their mouth. That's all I know. All right. It is Sharpe in the morning here. It's 6:39, and one of the great bloggers at our website you'll find at KFYI.com, and all you have to do is go to the drop-down menu where it says shows on the front page at KFYI.com. That'll take you to the Sharpe page, and there you'll find Voices Crying Out in the Desert. And Thomas Purcell is he's emerged as one of the smart guys in the Valley. He really has, and he writes an incredible blog at thomas-purcell.com. And joins us now because he's also a bit of an expert when it comes to insurance. And he's got a great graph that he thinks is worth talking about. And what it shows is what the relationship of premiums, to workers' costs are, what their wages are, and how that's changed because of Obamacare. Thomas, good morning.
Good morning, Jim. Thank you for having me on.
Oh, hey, anytime. And I like this. How did you arrive at this? Because this looks like this graph shows insurance premiums going up,
right.
And then you say, well, it actually would have kind of turned a little bit to the right, or at least not have taken as strong a turn to the left and gone up higher. How did you arrive at these conclusions?
Well, if you look at it, there was a bubble back in 2005, 2006.
Mm-hmm.
There was an increase in premiums because of the nature of the industry. Some of the costs were being shifted. HMOs were not being used as much, and so naturally premiums had a moderate bubble. But I matched the bottom line, where would we be without Obamacare, on the overall length from 1999 to 2012, and allowing for inflation. And then I added the orange line based on what workers' contributions are. And that's really the point of the graph, that while premiums have gone up moderately, we're paying more out of pocket for it. Because what has happened is deductibles increased and things like that, where free birth control, free lab tests, free preventative care, somebody had to absorb those costs. It certainly wasn't going to be the insurance company, because now you've tightened up the profit margin. And so there you see a great difference between what the actual premiums are and what we're paying for it. And really that bottom line is, what is our health insurance cost? Not what we are paying for it, but what is the actual cost to society?
Wow. This is a little hard, I think, for some people to do, but, the insurance industry, I think, in some ways needs to look inward and say, where did we go wrong? How did we get to this point? How did the federal government decide to, let's not just look at the people who are uninsured and try and fix that problem. Let's change the way everybody is covered to deal with the uninsured. Is there something the insurance industry could have done differently to get us to a point where we wouldn't be where we are now?
Well, I don't know if you remember this or not, but years ago, George Bush, the elder, Bush 41, had promoted the idea of HMOs, where insurance companies would manage the care in exchange for covering more. If you have an HMO policy, everything is covered. You go to the doctor, the lab tests are covered, your prescription costs are covered, everything you need is covered, 100%. The problem is, at least that's for the majority of HMOs, but the problem with that is that costs rise, and more importantly, if you remember, there were lots of lawsuits and lots of stories about my insurance company won't pay for this.
Right.
My insurance company, it was called managed care for a reason, because the insurance company determined what your coverage was in exchange for you getting more for your money. As a result, premiums went through the roof. That's to cover the lawsuits and the fact that the insurance companies now had to pay for everything, otherwise they'd be sued. Gradually, as the costs increased, people shifted to what's called a PPO, which is what most people have today. And what that is the insurance company does not manage the care in exchange for you absorbing some of the costs. As more and more people shifted to the PPO, they didn't understand the difference. They still expected their insurance company to cover everything.
Right.
And that's what you see on this chart in the bubble in the 2002 forward. You see a huge increase in insurance premiums. Then when Obamacare kicked in, the Health Care Act, it told insurance companies, listen, you can only charge so much for this. You're going to be managed by government. So what's going to happen? That gap in money, where's it going to come from? It's going to come from the taxpayer.
Oh, yeah. I have one last question, and this is actually kind of a personal question because I have an HSA, a health savings
Right.
account, which I've heard somebody say to me the other day, and I don't follow the insurance industry as closely as I should apparently. Somebody said to me the other day, there's a good chance HSA's health savings accounts are going to go away. Now, I'll tell you what, my wife had sticker shock when I went to the HSA because I pay a lot of money for prescriptions, and I pay more at the doctor than we used to pay. But that's okay because the company matches, and what I don't spend on healthcare in any particular year, I get to roll over and I get to keep. And I love it, actually. Personally, I think it worked out really well for me this last year. It's the first year I've done it. Is there a chance HSAs are going to go away?
Well, that's debatable. The tax advantages of them are becoming more and more limited. And as the costs of healthcare increase, I think you're going to see some sort of restriction. Now, what you're experiencing is exactly what this chart shows. Your workers' contribution to your health care is going up. Mm-hmm. And that is the net result. What is your money out of pocket, both in taxes, premiums, and costs, is your health care costing? And it's costing more than it ever has.
I got to tell you, though, it's so after I hit a certain amount of money, though, this other insurance kicks in and it basically covers everything for, at 80% or whatever. So I think it's a great deal myself personally. It looks like I'm paying more, but I think in some ways I'm paying less and I get to keep what I don't spend, which helps me to run to the doctor every time I get the sniffles. I think that's one of the positives about it. Thomas, great chart. It's on the website. You can check it out. And Thomas just writes about all sorts of different things, not just the insurance industry by any means. Great stuff. Thomas has been on the air with us many times too. It's you can find his website by going to ours. It's KFYI.com and just go to the Sharpe page by doing the drop down menu on the front page there where it says shows. Coming up.